Welcome to Michigan Medicine HomeMed Infusion Pharmacy. This video is a tutorial for using an infinity pump to infuse your tube feeding formula. For infinity pump feeding administration, you will need an infinity pump bag, an IV pole, formula, a 60 milliliter syringe, and room temperature water. After you have gathered your supplies, wash your hands. Ensure that you are sitting upright. If lying in bed, ensure that your head is elevated to at least 30 degrees. Remain elevated during the feeding and 30 to 60 minutes after the feeding. Start with a new feeding set. Shake your formula container to ensure proper consistency and pour the correct amount into the feeding bag, also called the infinity feeding set. Squeeze the bag to remove excess air and close the cap. Hang the bag on the IV pole so the bottom of the bag is just above the pump. When you set up your feed, you will have to do 3 steps. Load the set, prime the pump, and ensure your hourly rate is correct. Loop the blue tubing around the black wheel of the pump and stretch it slightly to the right. The plastic portion should drop into place. Close the lid by pressing the tab in until the latch clicks into place. Turn your pump on by pressing and holding the on-off button for 2 seconds. The pump will run through a short self-test. Next, you will then need to prime the pump set tubing. Priming allows you to get all the air out of the line before attaching the feeding set to the feeding tube. There are 2 options for priming the tube. The first option for priming the line is to use your infinity pump. Remove the plastic protector from the end of the feeding set. Hold down the prime button. While you are holding the prime button, the screen will say to stop, let go, indicating that you will need to hold the prime button until the tubing is full of formula and there is no more air present. The second option for priming the line is to manually prime the tubing before loading the set into the pump. To manually prime, locate the etched droplet on the soft rubber part of the cartridge. You will squeeze this area on both sides while simultaneously squeezing the bag. The formula should begin to flow through the tubing until there is no remaining air in the line. This takes some practice, but is the faster method of priming once you get used to it. Your third and final step to setting up your feeding is to program your hourly feeding rate. You will see on the screen that it currently says rate and 125 milliliters per hour. If we want to adjust the rate, we will simply use the plus/minus buttons to adjust the rate to where it needs to be. Note that this pump contains decimals when programmed lower than 10 milliliters per hour. So if your rate is supposed to be 6.5 milliliters per hour, ensure that the rate is entered correctly and you are not administering 65 milliliters per hour. We will set our feeding rate to 65 milliliters per hour. If your pump is not on the rate screen, you can use this rate/dose button to toggle back to the rate screen. If you press that button again, it will take you to the dose screen. We recommend that you keep the dose programmed to INF or infuse. This means your pump will infuse your feeding at the programmed rate until you turn it off or the feeding bag is empty. If your dose screen does not indicate INF, you will press the plus button until it reads INF or infuse again. If you are a HomeMed patient, the Feed INT is a pump feature that we do not recommend using at home, and your pump has been programmed for your interval to say none. The volume/total button keeps track of how much formula has been administered. Some people like to keep track of total daily volume. You can reset or clear this out by pressing the clear button. Let's review the 3 steps to setting up the pump. We have loaded your set into the pump and clicked the cover into place. We have primed the tubing so there is no air left in the line. Our feed rate on the screen is correct. This feed is ready to be connected to your feeding tube. Remember to flush the feeding tube with the amount of water recommended by your clinician prior to connecting the pump tubing. Once you are ready to start your feed, press the run/pause button. The pump will run at the hourly rate you have set until the feeding set is empty. Refer to your feeding schedule provided by your dietitian to know how much formula you can put in your feeding bag at one time. If you need to pause your pump, you can press the run/pause button. The pump will hold or pause for 2 minutes. If you need to pause longer than 2 minutes, you can power the pump off. If more formula is needed, remove the tubing from the pump and rinse out the feeding set with tap water. Refill your feeding set according to your feeding schedule and restart the feedings. Disconnect the feeding set from your tube and provide a water flush of at least 30 milliliters of water. Discard the feeding set after 24 hours of use or as directed by your clinician. For information about cleaning the pumps, battery life, and backpack usage, please refer to your Infinity Pump User Manual. If at any time you have any questions or concerns regarding your Infinity Pump or your home tube feeding, please contact HomeMed or your home care company.